Diamond Fernandez here, just completing this talk on talking about the role of nitric oxide. And when you look at the role of nitric oxide, it's one of my favorite supplements out there, or things that you should definitely do to relax the blood vessels, dilate it, and it's been shown study after study as to the benefits of taking nitric oxide. So if you have high blood pressure, which is what we're talking about in this lecture, or if you have even diabetes or even artery disease, this is an important supplement to take because of the benefits of what it focuses on. So today I'm going to talk about the role of nitric oxide and what it does so that you can understand that a little bit better. So when we talk about the benefits of nitric oxide, vasodilation occurs. You can see small vessels become larger. Platelet aggregation, it prevents the blood vessels from sticking together. We get monocyte adhesion. Now you know that arteries are a muscle, right? Not a pipe. Now you can understand that there's monocyte adhesion that we look at. It prevents the cells, the endothelial cells, from getting sticky. And so then we also get smooth muscle proliferation, superoxide, radical elaboration, and we prevent LDL oxidization. Remember, that's the breakdown of LDL as it undergoes inside the lining of the arterial wall. So that's why it's important to look at those other videos that I did on understanding the arteries are a muscle, not a pipe. And so when we look at how we generate nitric oxide, it all starts off in a nitrate, then converts to nitrite, and drops an oxygen molecule every time to become nitric oxide. So NO, which is nitric oxide, is just a nitrogen molecule and an oxygen molecule. You can see we drop a molecule as it gets synthesized through our digestive system. So when you have dietary nitrates, of course, I want you to have those beets. Of course, I want you to have those green leafy vegetables, things that contain a lot of healthy nitrates to that. It gets digested in the salivary glands. And then what happens is it then goes into the stomach and it converts, even a little bit, it converts into the mouth from NO3, which is nitrate, to then nitrite. And then it goes through the intestine as nitrite, and then gets distributed into the peripheral, the blood vessels, as nitric oxide. And so that's how the physiological function happens from taking a molecule from nitrate down nitrite to nitric oxide. And so when we look at these pathways, and you can see, if you just Google nitric oxide supplements, you're going to find L-arginine out there. And you might have heard of some companies that, hey, you got to take L-arginine. Well, the problem with taking L-arginine as you age, it's the wrong way of making nitric oxide. So you can make nitric oxide from two pathways, either L-arginine, nitric oxide pathway, or you can take it from the nitrite, nitric oxide pathway. It's hard to say a number of times in a row. And so this is the correct pathway that you want to go about, not the L-arginine nitric oxide pathway. And so when you take L-arginine and we add it with oxygen, we use this nitric oxide synthase, which is an enzyme that converts L-arginine to nitric oxide. Now the concern is when you go through that pathway, and specifically through that pathway, we don't make enough eNOS, which is nitric oxide synthase. And so therefore it has the ability to then get oxidized back to nitrate and nitrite. And so it gets broken down and goes back to the other way. But the nitric oxide that you do end up through that pathway, you get the biological effects of having nitric oxide in our blood vessel. Now the concern of going down through this pathway, I'm going to get into a little bit more in the other slides, is that this does not work as we age. And in fact, there are a lot of things that can affect our pathways as to when that happens. So the correct way to do this is through diet or specific supplements, which I'll get into in a second. You take this nitrate as an NO3, it converts to nitrite, again in the digestive tract. That's why chewing your food is so important, because it activates those enzymes to break down that, including in the stomach. And then it gets converted to nitric oxide, which and then you get the biological effect of using that. And so that's why it's important that you go down the right pathway. The pathway on the left is not where you want to go down to increase nitric oxide and get the benefits of what nitric oxide can do. Nitrates, nitrite, nitric oxide pathway is where you want to be. And this is very important because, again, if you Google supplements out there, if you see on Google, you just take your phone and Google that, you're going to find L-arginine supplements, and that's not what you want to take. That's old literature. That's old stuff that's going through to decide that part of it. So the L-arginine pathway, again, you can Google nitric oxide supplements. You'll find a lot of L-arginine products. So why that's a problem is the cells do not get to use extracellular arginine to make nitric oxide. So what happens is you actually require a super amount. So L-arginine is something that you can get in your foods, right? And so when it's in your foods, that low dietary L-arginine, your body can take that pathway and make nitric oxide or do some benefit from there. However, it's not as great. But if you ingest L-arginine as a supplement, it converts to nitric oxide, but it has a problem. You require this nitric oxide synthase. So that's an enzyme that has to work. And actually, as we age, especially in the population that we deal with, like in our clinic, I mean, our sweet spot is around 55, but you're starting to lower nitric oxide production. And so you also require L-citrulline to help that production of nitric oxide. And so cells use intracellular L-citrulline to produce arginine to make nitric oxide, and you can see that on the right. And then the problem is that enzyme to convert to nitric oxide, the nitric oxide synthase, so the NOS, or eNOS is actually called, it can get saturated too much, and then it doesn't work. It actually doesn't work that well anyways, but now it doesn't work at all. And so as you age, it becomes dysfunctional, and then it's counterproductive because it'll only increase oxidative stress. So now you get the reverse that happens. And so when it gets broken down, the nitric oxide can get oxidized. And when it gets oxidized under this pathway, then you end up with converting it back to nitrite and then nitrate. And so it becomes counterproductive. And so, and another thing is, especially if you have endothelial dysfunction. So how do you know you have endothelial dysfunction? Is if the artery wall is compromised, if you don't pass our tests well, or if you have artery disease, you had a heart stent or bypass surgery, or even if you've had diabetes. These are ways that it can actually impair with the NOS, the nitric oxide synthase molecule, and so the enzyme. And so it impairs with diabetes. And there's a whole bunch of things I can share with you with diabetes on that side of things. And so increasing the supplement arginine will not necessarily increase nitric oxide synthase function, and therefore it increases these free radicals that can happen. So you get the arginase breakdown, which can be then counterproductive and cause that oxidative stress to the arterial wall, which is what we're trying to avoid, as you know, from the infinite markers that can happen in those three finite responses. So the correct pathway that you want to do, L-arginine, you actually want to do the nitrate. And so when you look at this pathway, you get this endogenous source of arginine. This is the problem. The NOS, the nitric oxide synthase, is the problem, where it converts to nitric oxide. This pathway doesn't work as well. But when you get exogenous sources like that and through drugs, the nitrate converts to nitrite, converts to nitric oxide. But in this pathway, if you go arginine nitric oxide, it can get broken down back to having a nitrate. And then you get the biological effect of having nitric oxide or increased nitric oxide to the endothelial lining of the wall. That's what we're trying to focus on here. So the nitrate, nitrite, nitric oxide pathway, it basically bypasses the whole NOS enzyme system, the nitric oxide synthase enzyme system. And it's more safe, it's reliable, and it's a way more effective way of increasing nitric oxide, which is what we're trying to do. And so where are nitrates found? Nitrates found in beets, beet juice, so I recommend that, green leafy vegetables, and a Mediterranean diet. That's where you're going to get the most healthy nitrates. And so when you look at that in your diet, that's where we want to get the abundance of those vegetables and fruits to be able to use that, chew that food and convert naturally in your body. The concern is that you're not able to get a huge amount of the nitric oxide that we do require. Now, you're always developing nitric oxide, otherwise, unfortunately, the vessel's dead. So you're always developing nitric oxide. What we're trying to do in terms of reversal of disease, reversal of hypertension, reversal of diabetes, is we have to increase nitric oxide production greater than what we can find in foods. And there's a bunch of studies out there that talks about the benefits of nitric oxide. And when we talk about it from a food side of things, let me get into that part of it. I don't have the slide, and I should have put it in this presentation. But when we look at the slides of how much food we actually have to consume to get the same therapeutic nitric oxide, we're talking about like 26 celery sticks and 9 green leafy vegetables. Now you're all going to get benefits from that, absolutely. However, to get to the benefit of getting more nitric oxide to have a reversal of disease, you're going to have to supplement with the right source. And so the benefits of nitric oxide is it does dilate arteries and it reduces blood pressure. It improves blood flow. It's a precursor to stem cells, improves cardiac cells, decreases monocytes. Remember when you look at the arterial wall, that immune response that happens, that monocyte activation, it decreases. It helps with sexual function with females and with males. So females and males can have sexual dysfunction. It regulates inflammation, it improves immune function, and helps diabetes. And with diabetes, it's quite interesting. And you actually, so I'm going to go back here a second here just so we understand this. This nitric oxide synthase is so important to understand that if we were to take this away, because you're always coming through both these pathways, you're coming through arginine and nitrate. It's just that you do not want to supplement with arginine. So understand that part of it. So when you're coming down that arginine pathway and you're using nitric oxide synthase, diabetics lose that ability to that. And in fact, this is a study done in mice. When we take away the nitric oxide synthase in mice, they actually become diabetic. And the concern with diabetes is not necessarily the diabetes disease at its own. The disease itself can affect the vasculature, so it can cause strokes, eye problems, heart disease. And so those are the things that we're concerned about when you're diabetic, and so it's important to improve the nitric oxide production at that level. I know we're talking about hypertension here, but hypertension is also one of those markers that gets increased with this part. And so when we know the benefits of nitric oxide, what hurts this production? What damages this pathway that is so essential and the best pathway to improve nitric oxide production? And so let's cover that. And so mouthwash. There was a study, and I should have put this in here, and I apologize for not doing that, but the idea is that they gave mouthwash, and this was to university students, and it decreased nitric oxide production by half by giving mouthwash for just a week. So stay away from mouthwash is really what I'm getting at. Mouthwash changes the enzyme structure and what your ability to break down in your mouth. And so that's the problem with taking a mouthwash, is you lose essential bacteria and things that are used to help the nitrate turn to nitrite. And so mouthwash damages that process. An unhealthy oral microbiome and tongue. And so this is where it's important to make sure you get regular teeth cleaning, that you have good oral hygiene. That's why dentists are a good referral source for us, because if they see an unhealthy oral microbiome, what is happening to the arterial walls? What's the risk? And when you change the oral microbiome and you change in all these things that we're talking about together, we see an improvement in arterial health. And so inflammatory diets can cause this problem. A lack of stomach acid. So remember, we're trying to take nitrate to nitric oxide. Proton pump inhibitors. So if you have acid reflux and you're taking antacids or that proton pump inhibitors like pantoprazole or omeprazole, these drugs, yes, okay, that makes it prevents GERD from happening, which is reflux disease. Yeah, it minimizes that, but it's the wrong way to do that. If you have reflux disease or you have the stomach acid that's coming into the throat that mimics angina pain, and it happens when you're on blood thinners and all that part of it, please don't, my suggestion is not to take a proton pump inhibitor. There are other options that we can focus on to improve. Remember, 90% of diseases start in your digestive tract. Proton pump inhibitors are something that we want to stay away from. NSAIDs are another thing, and antibiotics can affect the bacteria, of course, in the stomach acid. So understand that those are some important things that hurts production. Pollution or heavy metals can that can hurt this pathway, and aging. So things that we can't control. And of course, at our clinic, we like to anti-age. And how we anti-age is by focusing on increasing nitric oxide the right way, focusing on all the healthy things that we talk about, making sure you supplement really well so we can anti-age. And then methylation. Methylation is another test that we do in our clinic. It's a genetic marker, but it sees how you process specific things in your body, and so that's another thing. So the blood pressure studies that we focus on, that we did in our clinic, Neo40 is a Neo40 Professional. I think that's an amazing brand to help increase nitric oxide production. Another thing that we're seeing just as well is Resync, and that's the Resync blood pressure study. So if you're interested in this part of it, we can do weekly visits to our clinic, and we do a central blood pressure and pulse wave analysis to show you the benefits. And every time you come into our clinic, whether it be an assessment or care plan review, we're always going to do this measurement to see how well you're doing, just so we can it's a quick way of just testing to see where you're at, to see what's going on. So this is all the ways in how we improve nitric oxide production. This is all the ways that we improve nitric oxide production, specifically with these two products is what we focus on to increase nitric oxide. So thank you for watching. Thank you for listening. If you have any questions, comments, or observations, I always welcome them at any time. And we look forward to helping you live happier, healthier, and longer.